It's that time that we talk all matters health. A warm welcome to Health and Lifestyle. My name is Marie Yambo. Our social media handles at KBC Channel 1 on X and KBC Channel 1 TV on Facebook is where you can interact with us. Now, cosmetic surgery is becoming increasingly common across the world as more people seek procedures aimed at enhancing their appearance, boosting confidence or addressing long-standing insecurities. Driven by advance in medical technology, greater awareness and the influence of social media, treatments once considered exclusive to celebrities are now more accessible to the general public. In Kenya, interest in cosmetic procedures has also grown in recent years, with more men and women openly discussing treatments ranging from non-invasive enhancements to surgical procedures. However, as demand rises, health experts continue to emphasize the importance of patient safety, thorough research and seeking care from qualified professionals. That is going to be our topic of discussion today on cosmetic surgery. But before that, let's have a look at the highlights. Coming up.
I'm the only person who looks at myself and lives in my own skin. You know what I mean? It's not about an outside influence, it's not about anyone else. It's how I feel in my skin, and I don't feel comfortable.
The rising demand for cosmetic surgery, a personal journey and decision.
So what we do is we go underneath the skin and then we melt the fat and then we suck it out, and then the laser tightens the skin at the same time.
Inside cosmetic surgery, a plastic surgeon explains the process. And on good practice, what to know before cosmetic surgery. And to our first segment now, where cosmetic surgery is no longer the taboo topic it once was. Around the world, more people are openly talking about procedures they've had, why they chose them, and the impact those decisions have had on their confidence and self-image. Media personality and actress Anne Moura knows this firsthand. After spending nearly 5 years researching breast augmentation, she eventually decided to undergo the procedure, and now she opens up about her journey. After nearly 5 years of deep research and consultations, Anne Moura decided to undergo a breast augmentation procedure.
And I really was intentional about making sure that I have the right research, I have the right clinic, I have the right place, and that's what I got with Avani Clinic. I was like, okay, this place, I can trust them, and I know I'll be okay.
For her, the decision was a deliberate journey towards self-assurance.
So if someone was to say, like, what's not making me feel happy about what I look like right now, I'm the only person who looks at myself and lives in my own skin. You know what I mean? It's not about an outside influence, it's not about anyone else. It's how I feel in my skin, and I don't feel comfortable. And I know if I can make it better, then I would make it better. That's an option that's available here at Avani Clinic. That's perfect.
Unlike traditional breast implants, which involve inserting silicone gel through major surgery, Anne opted for a minimally invasive alternative. The procedure takes only about 15 minutes.
So what I'm getting is the first time in Africa, but it's been done for quite some time. It's underneath the muscle, and it's like a balloon. Like it just literally like blows up, and then, you know what I mean? And it sits right there. And if you want to deflate it, everything will come back to the way it was before. So it's super safe. It's 15 minutes as well, which I really like. You can come in the office, go to work, go get your breast done, go back to work, and everything is fine. Recovery time is a lot lower as well. 2 weeks and you're good to go.
The decision, however, was not made overnight, mindful of the growing number of horror stories involving unqualified practitioners and botched cosmetic procedures.
The reason why I decided to get a breast augmentation is because it's taken years of deciding this. As I've gotten older, things are getting older with me, apparently. That happens in life. But I did the research, and this is something I just feel like will make me feel happier.
In an industry where clinics often promise perfection to make a quick sale, one of the things that reassured her most was having a surgeon who was willing to be brutally honest and say no when her expectation did not align with what would look naturally or medically appropriate.
What I wanted, oh my gosh, I was gonna look like a fish. Honestly, I was gonna be like a puffer fish and falling down. And the doctor was like, no, that does not fit your frame. That's not right for you. And he showed me options of what is more appropriate and available. But the fact that doctor said no is so essential to me doing this. You know what I mean? Because any doctor can say yes, anyone can take a check.
She describes social media as both a blessing and a curse. While it provides unprecedented access to information and expert medical advice, it also exposes people to dangerous misinformation and unrealistic beauty standards.
Social media is a double-edged sword, if we're being honest, right? You have excess information on one hand, which means you can't find the right doctors and the right clinic. On the other hand, you have back alley people, right? They have no accreditation. They just open up an Instagram shop and good to go. Here's what I can do. And that's where you see a lot of people dying from cosmetic surgery. Because don't forget, it is elective. So with social media, you really have to do your research. You really have to understand like what you're getting into. And don't let anyone else influence you. And that's why I say it's a double-edged sword. You have the good and the bad, like in life and in anything, really.
Anyone considering cosmetic enhancements should do extensive research, she says, seek qualified professionals and make decisions based on their desires and not outside pressure.
That's very fair. You know what I mean? That's so fair. People criticize everything in general, religion, like life choices. You see mom blogs, everyone's being criticized. So that's very fair. If it's not for you, it's not for you. If it's for you, then it's for you. I would say don't judge. Let someone choose what they want. But if someone's being influenced to do something that they're not comfortable with, then yeah, maybe criticize that might pull them off the ledge of doing something wrong. But other than that, everything's criticized, so don't worry about it.
As conversations around cosmetic surgery become more common across Kenya, Anne hopes her story will encourage people to change their priorities.
Okay, so let's say if someone has a fear, first of all, then you're not ready and you're not sure. Don't do it until you're sure. Do your research, number one. Number two, be aware of what you're doing because there's no reason to do this. You know what I mean? It's fickle. So be really aware of what you're choosing to do to yourself. Now, when it comes to being judged by other people, you wake up in your own body. You sleep in your own body. What is anyone else's opinion about that? You know what I mean? So if you're really happy with your decision, you've done the research, you've done the right work, then that's fine. Everyone else is just outside noise.
Well, self-confidence is just one of the reasons, as Anne has actually put it there, for her to decide to go through the breast augmentation. But on good practice, if you're considering cosmetic surgery, experts generally recommend taking a careful, informed approach before making decisions. Key steps include understanding what your motivation is and choosing a qualified surgeon. More on the good practice. Not everyone performing aesthetic procedures is a qualified plastic surgeon. Here are some issues to consider. Number one, verify the surgeon's credentials. In Kenya, a legitimate plastic surgeon must be board certified and licensed. Inspect the facility, not just the doctor. A major red flag in the cosmetics industry is the rise of med spas or beauty salons offering surgical or deep injectable procedures. For major surgery, procedures requiring general anesthesia must be done in an accredited hospital or fully licensed surgical center equipped with emergency life support protocols and a qualified anesthesiologist. Book a sit-down with a licensed surgeon and use this time to state your goals and concerns. Undergo comprehensive lab works to ensure you're a good candidate for cosmetic surgery and evaluate any underlying conditions like hypertension or diabetes that could impair healing. Surgery and post-operation aftercare. After the surgery, strictly follow the recovery timeline. This includes attending mandatory follow-up appointments for stitch removal and monitoring for complications like fluid buildup or infection. Well, on that note, we take a break, but when we come back, we will be talking to a plastic surgeon and we'll be delving more into what these processes are. Thank you for staying with us. As cosmetic surgery continues to gain popularity in Kenya, experts are urging prospective patients to prioritize safety, research, and realistic expectations before undergoing any procedure. And to better understand what patients should consider before going under the knife, we spoke to a plastic surgeon. There is a difference between cosmetic surgery and reconstructive surgery. So maybe you can make that clear for us so that people do not kind of use them interchangeably.
Reconstruction, we are talking about something like a birth defect, okay? Like post-injury, deformity, post-burns, we get people with contractures. All that, when you're correcting that, that is reconstruction. Then aesthetic is beauty. You come, you're not happy with your face, we make it okay. You're not happy with your body, we make it okay. Now that is aesthetic or beauty surgery.
So at what point would somebody actually come for cosmetic surgery? Because that's what we want to really focus on. I know, I mean, it's obvious when someone say, I mean, what kind of a question is that? Because definitely if somebody is not comfortable with how they look, or whichever way they perceive themselves, that's the reason as to why somebody might come for cosmetic surgery. But I'm asking that question just to tie it in, especially with our overall health and especially our mental health. Probably you could actually tie those things. So how does cosmetic surgery and mental health issues, intertwine?
Cosmetic surgery is really wide. Whatever you think that is not good in your body, you can change it from head to toe. Like people would come for the facelift, for rhinoplasty, for the eye bags, for the double chins. Some have double arms, the hanging arm, they want it sorted out. Then we have the tummy. Our main issue is usually there's fat here, which regions can you sort out? Then as you go down, you have people now aware about it. Some want it big, some want it smaller. You come to the thigh, some want it big, some want it smaller. So it's all a spectrum of everything. Is actually from head to toe. Beauty can be defined in every different way. When somebody comes for a consult, or somebody wants to talk to you, you really need to assess this person. I'll give you an example of two young people. One is a 21-year-old girl with a very, very small scar around the ear. But this girl can go to social events, she can come out of the house since she was 18 years old. Until her mother gets into it, says, now we need to do something. Why can't you do that? It's because of this scar, it's visible, everybody sees. So if you don't correct that scar for this girl, she'll stay indoors until she's 30 years. You see the mental health. There's a young man who has seen 3 psychiatrists because he's just not happy with his forehead. Young man, 25 years old. So until you could correct that, then he no longer sees the psychiatrist. He actually goes to the gym, says, now I want to lose the rest of the body. Because his main issue, he thought, I'm 25-year-old, I look like a 50-year-old man who's balding. So that is mental health.
And so if somebody comes and you've taken through the journey and they identified a certain part of their bodies and they're like, this is where I feel uncomfortable, I don't have confidence, it's affecting me mentally, and that is done, what's the likelihood of that recurring? And so how do you ensure that people do not obsess, if I may put it that way, with now plastic surgery or cosmetic surgery? Because it could just now create another cycle of problems.
That's a really important question. And we fight with it for a long time because every individual is different. When they come for a consult, there are people I know I need to do now as a psychological consultation next. I don't go to surgery, I don't go for preparation. There are people who come and I know, oh, this one will go straight away and do an operation. So we need to filter that one first of all out. Like this young man I talked to, once I did the forehead, we went through, I told him, now you're good. I don't even want to see you to see any doctor for the next 6 months. Can you do that? He promised me no. And he actually called me and told me, why was I seeing the doctors? That's what he asked me. Because that was a window. Once you correct the first thing, the funny thing is you must correct the first thing that is making them do that. Then that opens for you a window to enter into their life and now guide them to the right way. I agree with you, it's really, it can be something like addictive. You don't want, sometimes they tell them it's not really the money. I want you as you yourself to be whoever you want to be. That's why one red flag is when a patient comes to you with a photo. I want to look like this person. That is a very red flag that you need to pick it and say, this now needs psychological first of all, before you go to the surgical part of it.
So there have been concerns, in the health sector, but even among Kenyans, we've had people die when they go for these kind of surgeries. What would you want to tell Kenyans in terms of even just building that trust? Because to a certain level right now, people have kind of lost confidence with cosmetic surgeries.
Invest in the best. If it's anesthesia, invest in the best. If monitoring, invest in it. If it is infrastructure, invest in best, number one. Number two is the brains behind it. Who is doing it? What is the qualification? That is so important. I keep telling everybody like that. You must know who is doing like that. I am not a gynecologist, but you must raise a flag if you see me trying to deliver babies, you see? Yeah, you must raise that flag that, no, I don't think this is your training. So those are the things, first of all, about safety. Number one, where are you doing it? Number two, who is doing it? The third person now is you, the client. Were you fit for this surgery in the beginning? Not everybody is fit for surgery. You must know that. For example, people don't understand, like one of the cases that was going around, maybe somebody perforated the intestine of somebody. Maybe they just overlooked one thing. Before we go and do, let's say, liposuction, we do need to do an ultrasound. Look at the tummy. Is there anything on the surface? If there's something on the surface, correct it before the cosmetic surgery. So a few of those things. And lastly, there's no beauty ya bei ya jioni. I call it boy ya jioni. If you see somebody offering you bei ya jioni for beauty, that is a red flag. You must hold it like this. Because this is something that, it was not an emergency. It is something to enhance your body. But I can, come, I will do your tummy tuck. It's only 120,000. That's a very big red flag. You must know why. Why is he offering me that?
So if I come for liposuction, for that matter, or somebody who does liposuction, and that is the fat removal, and I want to believe that is the midsection, around the tummy and all that. Is that permanent? So can I now go back to my normal eating, not really care about my nutrition, or how permanent is liposuction?
The misconception is that liposuction is a weight-losing procedure. It is not. Liposuction is a shaping procedure. We want to shape you. You must do something else about your weight. So even if you came and I removed the fat, your diet is still poor, your lifestyle is still poor, you'll still reaccumulate the fat again. That one would have gone. The one I've removed, it will go. But even if I left 10 pieces of fat, they will grow to occupy the whole of the space that is remaining. So, as I said, it must be a journey. First of all, during consultation, you must go with the journey. Are you ready for this? You're not ready for this, we'll offer it. And I hope Dr. is going to talk about, we have a balloon to put in to help us lose weight first of all, before you go now for this. So once you come for the liposuction, we've removed the fat. Now you can have maybe excess skin. How do we take care of the excess skin? We give you a pressure garment do a massage, you do this. It's a journey.
So we've also seen a lot of acid attacks in the country. I do not know why it's becoming like a common thing right now, but those are the people who would actually be candidates for reconstructive surgeries and all that. How possible is it for someone who has had an acid attack to have, whichever part of the body that has been, affected, reconstructed and come back, if not completely, but at least to a certain level, become normal?
Acid attack as a plastic surgeon is one of the most difficult. Very, very difficult. Let's say just chemical attacks. Some will be acids, some will be alkali, some will be just other chemicals. Chemical attacks are really difficult to treat. Why? Because they have one thing. They penetrate the skin and go into the deeper layer, and they keep causing that problem. Suppose it had burnt the skin. The upper layer is called the epidermis. The inner layer is the dermis. It keeps going in and burning that. So, and the correction of the skin on top is dependent also on what is underneath. So sometimes it's very, very difficult. The reconstruction is very, very difficult, and it's very staged. I'm a part of what you call the International Society of Burn Injuries. And when I go for a session of chemical attacks in burns caused by chemical, this is one thing even the first world has not really solved properly about the reconstruction. What we try to do is, first of all, get the functions right. If it's an acid attack on the face and the eyes cannot close, we try and make them close. If it is affecting the mouth is whatever we try. Mainly the function first before the beauty. But the beauty is difficult and it takes long.
How does Kenya compare then to other parts of the world? It looks like cosmetic surgery has become, people might think like it's a new thing in Kenya, but maybe you will tell us whether it's a new thing. But how does Kenya compare to other countries when it comes to technology and all that?
The thing is, I love to travel, I love to see new things. And when I see people doing all these different things everywhere, I'm like, why not Kenya? Kwani, why are we so shallow that we cannot have the access to the same technology? So keeping that in mind, we have brought in the first smart lipo into Kenya. So smart lipo is a laser-assisted liposuction system. So what we do is we go underneath the skin, and then we melt the fat, and then we suck it out, and then the laser tightens the skin at the same time. We also have lasers that can help with chemical scars and burns as well, and we can combine plastic surgery with laser surgery to get more enhanced and improved results. The other thing that we have is a treatment called Lipo AI, where we use artificial intelligence and a laser to gauge the depth at which the liposuction is being done, so that we are more accurate and precise with less complications and less blood loss.
So there you have it. Cosmetic surgery has become popular. It's no longer a taboo. And if you're thinking about getting one, so now you know what procedures you're supposed to follow. And on that note, we bring health and lifestyle